What if the way you sleep tonight could quietly increase your risk of stroke without you even realizing it? Poor circulation doesn't make noise, it works in silence. And every night, millions of seniors over 60 or 70 unknowingly sleep in positions that put extra strain on the heart, slow blood flow, quietly increase the risk of stroke, and also increase the risk of dangerous blood clots. But here's the shocking truth no one is talking about. One simple adjustment in how you position your body while sleeping at night could lower your stroke risk by more than a third. I am Dr. Richard Ben, and I am a cardiologist with over 20 years of experience. And what I'm about to share is something I wish every one of my patients had known 20 years earlier. Right now, there is one sleep position that actively fights the blood clots forming silently inside your veins while you sleep. One position that takes serious measurable pressure off your heart every single night. And almost nobody is sleeping in it. Not because it is difficult, not because it requires expensive equipment, but because nobody, not your doctor, not your specialist, not the person who sold you your mattress, nobody sat you down and told you the truth about what your sleeping position is doing to your cardiovascular system every single night. I am going to change that today. The entire solution fits in one sentence, but that sentence needs the science behind it or you will not believe it enough to act on it. So I need you to stay with me until the end, because the position itself, with the complete science, the exact setup, and the precise reason it works, I am going to give you all of it. But only after I show you what is happening inside your body right now. The science is what makes this impossible to ignore. And the science starts now. My name is Dr. Richard Ben. 20 years working specifically with adults over 60 on cardiovascular health and stroke prevention. Over 4,000 patients. And what I kept finding changed the way I practice medicine entirely, patient after patient. People who took their medication, walked every morning, did everything right, were still having strokes, still developing dangerous blood clots. The answer I kept finding was not their diet, not their medication, their sleep position. Now I need to say something directly. The pharmaceutical industry profits when you stay on blood thinners for life. The mattress industry profits when you blame your bed instead of your position. Neither of them benefits from you watching this video today. I am not here to sell you anything. I am here because every adult over 60 deserves to know what is happening to their heart every single night. You spend 1 or 3 of your entire life unconscious. During those hours, you have zero conscious control over your cardiovascular system. Your heart beats 60 to 70 times per minute every minute all night. Your veins push blood from your legs all the way back your heart against gravity through vessel walls that have lost their tone and flexibility. After 60, your body produces significantly less nitric oxide, the compound that keeps your arteries relaxed and blood flowing smoothly. Nitric oxide production drops by nearly half after 60. Half. Gasps. That is your body's primary vessel relaxing mechanism working at half capacity while you sleep. Tighter vessels, slower blood, more resistance every single night. And slow-moving pooled blood does one dangerous thing above all others. It clots. Deep vein thrombosis occurs 3 times more frequently in adults over 60. When a clot breaks loose, it travels through your veins, into your heart, into your lungs, into the vessels feeding your brain. That is a stroke. Research in the Journal of Clinical Sleep Medicine found 72% of all strokes occurred during sleep or within the first 60 minutes of waking. The most dangerous hours of your day are the hours you spend in bed. Do you wake up with swollen ankles? Do you feel more tired getting out of bed than when you got in? Do you have leg heaviness that takes an hour to disappear? Type yes in the comments right now. Those are not random symptoms. Those are signs of circulation compromise during sleep. And later, I will show you a 15-minute routine that drains that pooled blood before you sleep. The data behind it surprised even me. Your heart sits slightly left of center. Your aorta curves left and downward. Sleeping on your right side creates a bend in your aorta like a kink in a garden hose. Blood flow becomes less efficient. Research in the Journal of Clinical Cardiology found right side sleeping increased nighttime palpitations by 28% in adults over 65. Not from structural problems, from mechanical pressure that should not have been there. I want to tell you about Sarah. She is 71, a retired school teacher from Ohio. She came to me after almost a year of waking at 3 a.m. or 4 hours in the morning with her heart pounding. Rapid, irregular, terrifying. EKG, Holter monitor, echocardiogram, stress test, everything came back normal. Her cardiologist said anxiety. Her GP said cut the coffee. She came to me as a last resort. I asked Sarah one question nobody else had asked. Which side do you sleep on? Always my right side, she said, my whole life. I suggested 2 weeks on her left side instead. 3 weeks later, she called my office. The palpitations were completely gone. She was sleeping through the night for the first time in a year. This was not a miracle. This was anatomy doing exactly what anatomy is supposed to do when you stop working against it. Now, I need to show you the 3 positions silently damaging hearts every single night. There's a very good chance you are sleeping in one of them right now, and understanding the damage they cause is what makes the solution impossible to forget. Let me start with the worst one first. Stomach sleeping is the single most cardiovascularly damaging position for an adult over 60. Your chest cavity compresses against the mattress. Your heart gets squeezed from outside while pumping from inside. A study in the Journal of Applied Physiology found stomach sleeping reduced cardiac output by 23% and increased left ventricle workload by 18%. Every beat working harder than it needs to for 8 hours. Over years, that weakens the heart muscle. Turning your head to breathe compresses the arteries supplying your brain, linked to a 41% increased stroke risk. Flat back sleeping looks neutral but is not. It causes a 67% increase in sleep apnea events in adults over 60. Every time breathing stops, blood oxygen drops, blood pressure spikes, vessel walls sustain damage. A 2021 New England Journal of Medicine study of 14,000 seniors found flat-back sleepers had 39% higher cardiovascular event rates. I know what some of you are thinking. I have slept this way my whole life. If it was really dangerous, wouldn't I already know? The damage from the wrong sleep position does not announce itself. It accumulates silently for years. Until one morning, the announcement is a stroke. A blood clot in the wrong place. A heart that has been working harder than it needed to for a decade. That is why this conversation matters. Right-side sleeping adds 2 more dangers. Your liver sits beneath your heart, creating upward pressure that reduces how fully your heart fills with each beat. And your lymphatic system, which clears inflammatory waste from your tissues, drains primarily on the against that drainage. Inflammatory waste accumulates. Chronic inflammation drives arterial plaque, vessel damage, and stroke. 3 positions, 3 mechanisms of silent damage. Everything I have described, the aortic curve, the lymphatic drainage, the venous return mechanics, the nitric oxide deficit, the clot conditions, all of it points in exactly the same direction. Your body has a preferred side. It has always had a preferred side. And the moment I tell you what it is, you are going to understand immediately why everything else I have said is true. Because it is not going to feel like new information. It is going to feel like something obvious all along. Sleep on your left side. That is it. That is the position. Left side with elevation, with the exact setup I am going to walk you through now. And the reason it works is written into your anatomy. It has been since before you were born. When you sleep on your left side, gravity assists your heart. Your aorta carries blood in the direction it naturally curves. A study in the Journal of the American College of Cardiology found left-side sleeping improved cardiac output efficiency by 17% compared to right side. The difference between a heart working hard and a heart working smart. Your lymphatic system drains inflammatory waste more efficiently. Less inflammation means less plaque, lower clot risk, lower stroke risk. A cascade working for you every night automatically. Left side sleeping also reduces acid reflux, which protects your heart's electrical system through the vagus nerve. If your doctor has never mentioned any of this, hit subscribe right now. I share exactly this kind of information every week for adults over 60. But left side sleeping is only the first layer. What I'm about to show you next multiplies every benefit I just described, and it costs nothing extra. Adding modest upper body elevation, 15 to 20 degree, multiplies the benefit of left side sleeping significantly. When your upper body is elevated, the pressure gradient between your heart and brain changes. Your heart works less hard. Blood pressure drops the way it is supposed to during sleep. Most people do not know this. Your nighttime blood pressure is a better predictor of stroke risk than your daytime blood pressure. Your pressure should drop 10 to 20% during sleep. Cardiologists call this dipping. If it does not drop or spikes, you are a non-dipper. Research in the journal Hypertension found non-dippers have 2.5 times the cardiovascular event risk of dippers. 2.5 times. An upper body elevation during sleep is one of the most powerful ways to restore healthy nighttime dipping naturally. A study in Frontiers in Aging Neuroscience followed 9,000 seniors for 6 years. Those sleeping with upper body elevated 15 to 20 degree had a 41% lower rate of hemorrhagic stroke and 36% lower rate of ischemic stroke compared to those sleeping completely flat. I want to tell you about James. He is 72, a retired engineer. For 3 years, his doctor had been managing dangerous nighttime blood pressure spikes with 2 medications. His readings were still not controlled. But what James did not say when he first came in was that he was afraid, not in a way men of his generation say easily. He would lie awake some nights watching the clock, wondering if tonight was the night something went wrong. His wife had moved to the guest room months earlier. The house felt quieter than it should have been, he told me. I explained non-dipping. I explained elevation, elevated his bed with simple bed risers. 6 weeks later, his average nighttime blood pressure had dropped 19 points. His cardiologist reduced one of his medications, and his wife moved back into their bedroom. He said, 3 years of pills, 1 conversation with you. Then, I wish someone had told me this earlier. So do I, James. So do I. This was not a miracle. This was physics applied to a human body every single night. Now let me give you the complete setup. And before I give you your action plan, I need to show you 3 mistakes that will make this protocol completely ineffective if you make them. I have seen all 3 destroy results for patients who were doing almost everything else right. But first, the exact setup. Every element of this setup has a specific purpose. Do not skip any of them. Element 1, upper body elevation. Your entire upper body elevated between 15 and 20 degrees. Not just your head, your entire upper body. Use a foam wedge pillow or bed risers placed under the legs of your bed frame at the head end. The head of your bed should sit approximately 7 to 9 and higher than the foot. Do not exceed 25 degrees or you begin sliding during the night and creating lower back strain. Element 2, the knee pillow. Place a firm pillow between your knees. Without it, your top leg pulls your pelvis forward during the night, compressing the major blood vessels through your groin and upper thigh. Compressed vessels mean reduced blood flow to your entire lower body all night. Knee pillow keeps hips stacked, vessels open, blood moving. Element 3, ribcage support. A small pillow or rolled towel under your left ribcage just below the armpit. This takes pressure off your left shoulder and prevents you rolling onto your back during the night. It keeps you in position without discomfort building through the hours. Element 4, head pillow height. And this is where I need to tell you about Norma because Norma made the mistake most people make when they try to do this on their own. Norma is 78, a retired nurse from Tennessee. 3 doctors had dismissed her symptom. Every morning, without exception, she woke up with a throbbing headache behind her eyes. 2 hours and 2 pain relievers to resolve it. Foggy mind until nearly noon. Told it was dehydration, blood pressure, just aging. A nurse for 40 years, she knew something was being missed. She was sleeping on a wedge with 2 thick regular pillows stacked on top. Her head elevated at nearly 40 degrees. At that angle, the arteries on both sides of the neck are partially compressed for 8 hours. Chronic overnight reduction of blood flow to her brain. 5 weeks after correcting the angle, she walked in and said before sitting down, "The headaches are gone. I wake up clear. My daughter says I seem like myself again." She had tears in her eyes. This was not complicated medicine. This was paying attention to the basics that everyone ignores. Your head pillow must keep your spine in a straight neutral line from neck to tailbone when lying on your side. Medium thickness for most people. Test it. Straight line, neck to tailbone. That is your correct height. Now, I want to stop for just a moment because I know some of you are feeling the weight of all this setup. Stay with me 3 more minutes because what comes next is the element that ties everything together, and the research behind it genuinely surprised me. During the day, blood and fluid accumulate in your lower legs and feet. By bedtime, your legs are carrying a burden your cardiovascular system must manage all night. When you lie down, that pooled blood rushes toward the heart all at once. Your kidneys respond by producing urine, which is why so many people over 60 wake up 2 or 3 times a night to use the bathroom. In many cases, that is not a bladder problem. That is a fluid distribution problem resolving inconveniently at 2 in the morning. Here is the protocol. 30 to 60 minutes before bed, lie on your back with legs elevated above heart level. Pillows, wedge, feet against the wall. Any version works. Hold it 15 minutes. Gravity drains venous blood back toward your heart and kidneys before sleep. Research in the Journal of Vascular Surgery found this reduced overnight venous pooling by 44% and measurably decreased clotting factors in the blood. And a 2023 study combining all of these elements, left side sleeping, upper body elevation, proper pillow placement, and pre-leg leg elevation, found that the complete protocol reduced the overall risk of cardiovascular events, including stroke and pulmonary embolism, by 43% over a 3-year follow-up period. 43% not from medication, not from surgery, from the position of your body during sleep. Now, I want to tell you about Smith. You do not have to have had a stroke or blood clot to understand what Smith was feeling. You just have to have lain awake at night wondering if tonight is the night something goes wrong. If you have ever felt that, you will understand Raymond completely. Smith is 70, a retired police officer. He had survived a pulmonary embolism, a clot that traveled from his leg to his lung 18 months before coming to see me. He was on blood thinners and being monitored, but he could not sleep properly. Every time he closed his eyes, some part of him was listening, waiting, afraid that the next clot was already forming somewhere he could not feel. His doctors had treated the clot. Nobody had treated the conditions that helped create it. I walked him through the complete protocol. Left side elevation, pillow setup, pre-leg drainage, every single element. 8 weeks later, he came in looking different, lighter somehow. He said, "Dr. Ben, for the first time since the embolism, I am not afraid to go to sleep." His blood thinner dose had been reviewed and reduced at his last hematology appointment. His morning leg swelling, persistent since the embolism, was gone. He was sleeping through the night. He said, "I thought I just had to live with the fear. I did not know there was something I could actually do." This was not a miracle. This was a body finally receiving the conditions it needed to stop fighting against itself every single night. That is why I make these videos, because there are thousands of people like Smith, like Norma, like James, like Sarah, people told their symptoms are just aging. People who do not know that some of the most powerful cardiovascular protection available requires no prescription, costs almost nothing, and starts tonight. 3 mistakes I see repeatedly that will destroy your results. Mistake 1, using regular pillows for elevation. They compress during the night. You start elevated and wake up flat with broken sleep on top of zero benefit. Use a proper foam wedge or bed risers. They hold their angle all night. Mistake 2, elevating only your head. Stacking pillows behind your head while your torso stays flat creates neck compression, not elevation. You feel like you are doing something right, so you stop looking for the real solution. Your entire torso must be elevated from below the shoulders. Mistake 3, implementing everything at once. Decades-old habits need gradual replacement. Add one element every 3 nights. By 2 weeks, every element feels completely natural, and your body is receiving 8 hours of cardiovascular support instead of 8 hours of unnecessary strain. Starting tonight, and sleep on your left side, pillow between your knees, 2 or 3 firm pillows creating some upper body elevation. 10 to 15 minutes before bed with feet elevated above your heart. Sofa arm, wall, pillows, any version counts. This week, order a foam wedge or bed risers, $40 to $70. Less than one specialist copay, works every night for years. Once your equipment arrives, complete setup. Left side 15 to 20 degrees elevation, knee pillow, rib cage support, head pillow at neutral spine, pre-sleep leg elevation every single night. Track your morning ankle swelling, mental clarity, bathroom trips, and morning energy. And I want you to make one commitment right now, 30 days, 30 nights on your left side with this complete setup. Come back to this video in 30 days and tell me in the comments what changed. I will be reading every single one. I know that sounds like a lot to hold at once. It is not. On the first night, it is just 3 things. Left side pillow between your knees, legs up for 15 minutes before bed. That is enough to begin. That is enough to start changing what has been happening to your cardiovascular system, possibly for years. The rest builds naturally from there. But before I let you go, there is one more thing I need to say to you, and it may be the most important thing in this entire video. I want to say something I mean completely. You are not broken. I know some of you have been told by doctors, by specialists, maybe by your own family, that what you are experiencing is just part of getting older. That the swelling, the fatigue, the palpitations, the poor sleep, that is just what 70 feels like. That is just the price of the years. I am telling you as clearly as I can, that is not the full truth. Some of what you have accepted as inevitable is mechanical, and mechanical problems have mechanical solutions. Your heart has not given up. Your body has not given up. It is working right now with everything it has to keep you here. It just needs the right conditions to work the way it was designed to work. You spent decades building the habits that brought you to where you are today. You can build new ones. Not because it is easy, but because the alternative, spending another night in a position that strains your heart and feeds the conditions for stroke and clot formation, is no longer acceptable to you. Not now that you know the position you sleep in tonight will either support your cardiovascular system or stress it. That choice has always been yours. You just did not have the information to make it consciously. Now you do. Start tonight, even imperfectly. Left side, knees supported, upper body slightly elevated, legs drained before bed. That is enough. Your heart will feel the difference before your mind does. Trust the process. Trust your body. It has been waiting for this. If this video gave you something valuable and something your doctor has not told you, something that genuinely changes how you approach the next 8 hours of your life, I have one request. Share it. Think of one person in your life who has had a stroke, who takes blood pressure medication, who wakes up every morning with swollen legs and does not know why. One click. That is all it takes to put this information in front of them. You might be giving them something that changes their health in a way nothing else has managed to do. The people who benefit most from this video may never find it on their own, but you can send it to them right now. And if you are new here, subscribe. Every week, I bring you clear, honest, practical cardiovascular health information designed specifically for adults over 60. No products, no agenda, just the science and what it actually means for how you live your life. The pharmaceutical companies and the supplement industry are not funding these videos, which means everything I tell you is driven by one thing only: what the evidence actually shows. Subscribe so you do not miss what is coming next. Before you go, I want to hear from you in the comments. Which sleep position have you been sleeping in, and what are you going to change tonight? And remember, come back in 30 days and tell me what happened. I will be reading every single one. If you have had a stroke, a TIA, a blood clot, or a cardiac event, your story matters here. Share it. Someone else is watching this right now who needs to know they are not alone. Your experience might be exactly what gives them the courage to make a change. I am Dr. Richard Ben, and I will see you in next video. Thanks.